Hello, Nutrition 115 students, and welcome to Nutrition and Physical Fitness for Everyone, chapter or unit 27 in your book. So let's do a little overview, an introduction to physical activity, and a little bit of its definition. So it offers something for everyone. So it doesn't matter who you are, what ethnic group, what race, what shape, what disease state, what healthy state you're at. It offers benefits for everyone. Now, physical activity involves body movements produced by muscles that require energy expenditure. Now, physical activity is a very broad category of human movement or an overarching term. It can be as easy as parking your car far away to walk a little bit more. It can be as easy as taking the stairs instead of the elevator. So it's not very prescribed per se in components, but it's very intentional. Now, exercise, which is more prescribed, is a subcategory of physical activity, and it's very structured and often involves things like intensity, how hard you're going to work out, how long, so the duration, the volume, how much work you're going to be performing, and also the frequency, how often you'll be performing that. So exercise is a little bit more prescribed for those kinesiology majors in here. It is generally planned, again, structured and repetitive, both physical activity and exercise. But like I said, exercise is a little bit more structured and prescribed. It's a little bit more of a science. And the terms physical activity and exercise are often used interchangeably depending on what type of environment you are exposed to. So physical activity has much to offer the athlete and the non-athlete alike, okay? I know that I worked out when I was pregnant and it offered lots of benefits for me as well, such as a boost in mental clarity, a boost in self-esteem, and it also helped me regulate how much weight I gained so that I wasn't gaining more than what was required for my height and stature. It provides recreation, which is good for both the body and soul. I also want you to know that there's lots of physical activity options up there, so you should explore. There's anything from dancing to people that meet up at parks based on special interests. I've seen sword fighting. I've seen all kinds of recreational physical activities out there in the public. It doesn't have to cost anything. In fact, YouTube has lots and a plethora of fitness channels that you can view from your home and do from your garage or inside your home. It benefits almost everyone. And again, it can be altered depending on who you are. And if you have conditions, sometimes it's good to see experts and professionals that have the credentials. And at its best, physical activity results from play and has positive consequences for health and well-being that we'll discuss here in a little bit. Happy consequences of physical activity. Why don't you go ahead and ask people who are in good physical condition and ask them what they get from physical activity, and you'll likely hear many reasons or a variety of responses. Now, what I want you to know is that regular physical activity benefits both physical and psychological health in people of all ages. In fact, I'm someone who enjoys increasing my expertise in eating disorders. We're finding that physical activity is part of a prescription for the treatment of eating disorders. We're starting to incorporate that into the treatment of eating disorders. Also, by improving a person's physical health, regular physical activity helps also ward off disease, like heart disease, obesity, some types of cancers, hypertension, and stroke, osteoporosis, and diabetes as well. And it tends to increase a person's feeling of well-being, and it helps with relieve depression, anxiety, and stress. It's going to be a prescription in regards to a lot of disorders and diseases that we may experience as human beings. Now, this is straight from your book, so it indicates some factors as far as what are some certain diseases and disorders that may reduce the risk of and also help manage them better, and also prevent more progression of them and improve sense of well-being as well, such as helping relieve your stress, your risk of dementias, and from feeling fatigue. Believe it or not, some certain type of fatigueness, depending on what it's occurring from, may be relieved from some exercise, because it depends what is causing the fatigue. Exercise might be part of that prescription. So the bonus pact, I guarantee anytime someone has a certain disease or disorder, usually part of that treatment involves physical activity and improving your dietary patterns. So when combined with other healthy behaviors, these have a huge effect and huge improvement on one's disease state or disorder. Now, regular physical activity also helps build bone mass and reduce the risk of bone fractures, again, with proper um, technicalities, proper form, proper cancel. Now, but the risk is lower to a greater extent if physical activity is combined with a diet, like you see here, the bonus pack, that supplies adequate amounts of calcium and vitamin D and other nutrients. I also want you to know some other benefits of exercise, such as reduced chance of developing colon cancer, breast cancer, may be related to the effect of exercise on reducing the ill effects of high levels of body fat on health. I want you to know also from my background, I have an undergraduate degree in kinesiology. I learned that people who are more physically fit, especially aerobically, develop more lipases within the cells, which are enzymes that help process fats and therefore are better processors when it comes to fats in the body. Okay. And then again, from children to elders to pregnant women and individuals with physical and cognitive disabilities, regular physical activity improves respiratory fitness, which is part of your cardiovascular system, like the heart and arteries, your muscle function, your nervous system, your mental health, and your energy levels. Okay. Now, if regular physical activity is one of the few factors that we can identify that help people reduce weight gain that happens with age. And most of us tend to gain about a pound. Research is finding that most people after their mid 30s are starting to gain like a pound per year if they're not on a good dietary plan or healthy lifestyle plan along with physical activity. Exercise and body weight. So just some information is that combined with a moderate decrease in normal caloric intake, moderate means like about 200 to 300 calories per day. Your book says 200, but other textbooks will say 200 to 300 per day. It can help people lose body fat, build muscle mass, and become physically active. Now, there's more to this. We're going to learn about those components of fitness that helped also lose weight, lose body fat in the form of lose weight in the form of body fat, build more muscle mass, and become more physically fit. So it's not just reducing to how many calories, but also what you eat and how you exercise. Now again, exercise alone is generally ineffective or less effective as a weight reduction measure than is exercise plus a reduced caloric intake. So it's showing here that people on exercise programs alone compared to people that incorporate exercise and caloric decrease are able to experience better benefits in regards to body weight and body composition. Okay. And whether or not regular exercise helps overweight people lose weight and keep it off depends primarily on caloric intake as well. So they tend to affect each other. Okay. And people who enjoy physical activity because it is perceived as being fun or pleasurable are less likely to reward themselves with high calorie foods, which I found in a way is kind of my experience. Calorie cost of various types of exercise. So if you want to know how many calories you're utilizing, depending on different types of exercise methods you're incorporating into your lifestyle, there are charts in your book, and also you can find many online. So if you don't find a certain type of exercise in your book and how much calories you're expending per hour, make sure that you also utilize the internet for that, because the internet has a plethora of charts covering plethora of aerobic, muscular activities and flexibility activities and stretching activities and so on. Okay. So we have more. This is also from your book, so it's covering more exercise activities that you can perform and how many calories they expend per hour. What is physical fitness? So when you call someone physically fit, you don't necessarily judge them based on how they look from the outside or superficially. Physical fitness is not defined by bulging muscles or how thin you are or the amount of physical activity you perform. Again, overweight people as well as people can be physically fit or not, okay? And it's a state that is measured by components. So we have to measure the muscular strength and endurance of a person, their cardiorespiratory fitness and flexibility. Now, some of these assessments can be done by simple tools that are non-costly, whereas if you want more accurate results, you would have to go to clinical settings in order to get them done, and they can be quite costly and require a lot of tedious work and preparation for both the assessor and the person that's performing the assessment and the person that's being assessed. Now, there's some components of physical fitness. Muscular strength and endurance, when we measure that, we're measuring the strength. We're measuring the strength component of physical fitness when it relates to muscular strength, the level of maximum force that a muscle can produce, usually in one repetition. So we're measuring how a certain muscle or a group of muscles, how much force they can exert on one repetition. That's muscular strength. Okay. Now, muscular endurance refers to the length of time that muscles can perform physical activities. And just to expand on that, it's the ability of a muscle or a group of muscles to sustain repetitive contractions against a resistance for an extended period of time. We also call muscular endurance muscular fitness as well. So those terms are synonymous. Now, when we measure cardiorespiratory fitness, it's the ability of the circulatory and respiratory systems to supply fuel during sustained physical activity and to eliminate these fatigue products after supplying fuel. And some of those fatigue products can be like lactic acid. In cardiorespiratory fitness, another name for it is also called aerobic fitness and cardiorespiratory endurance. The flexibility is how well your joints can move through something called range of motion. We also refer to range of motion as the acronym ROM. Now, certain joints have a certain ability to move over a certain range of motion. So we measure how you can move that joint based on what that range, a standard range of motion for that joint is. And a little bit more, range of motion is the measurement of the amount of movement around a specific joint or body part. And it is commonly measured during a physical therapy evaluation or during a course of treatment or even during just regular assessments to people that are experienced in the field of kinesiology and are able to perform these tests as well. Okay. Cardiorespiratory fitness relates, again, like I mentioned before, to the circulatory system, the heart, the lungs, which includes the arteries and the blood vessels and the capillaries as well. Okay. Muscular strength. So let's cover muscular strength a little bit more. So we're going to go ahead and cover these components a little bit more individually. So muscular strength depends on the ability of a muscle or groups of muscles to lift, pull, push, or otherwise exert force against a weight or opposing force. So it's not always just heavy lifting. It can be there's many types of resistance, okay? You can even be pushing against a wall. Muscle building activities are also called resistance exercise, okay, as well. So when we talk about resistance exercise, you should also be thinking about how to improve this muscular strength component of the human body. Now, such activities require muscles to work harder than usual, which increases muscular strength over time. Some exercises include lifting weights, doing pull-ups, push-ups, and using like stretch bands, okay? And I have a little bit more information here. So it says here, resistance exercise increases muscular strength, mass, power, and endurance, okay? So I did mention this before. So muscular strength resistance exercise is also called resistance training, strength training, and weight training. So other names for types of activities that increase your muscular or improve your muscular strength fitness is resistant training, which may include weightlifting, pushing against your own body weight using stretch bands. We also call resistance exercise. Other terms that we use is strength training and weight training, okay, and resistance training. Strength building exercise includes lifting weights, doing, like I mentioned before. So when we talk about improving your muscular strength, we're talking about performing an example of such exercises. So here's an image from your book. So this female's doing pull-ups to increase her muscular strength. So let's cover muscular endurance, also known as cardiorespiratory fitness. So these are synonymous terms. Again, muscular endurance is different from muscular strength, that it measures the ability of a muscle to sustain repeated muscular contraction against a weight or force over time or a longer time. Okay, so it's more repetitive and it's performed over a longer period of time. Now, the length of time muscles can work against a weight or force depends on your cardiorespiratory fitness. So in regards to cardiorespiratory fitness, we're looking at your respiratory system and your circulatory system, okay? Which includes your lungs, your heart, your arteries, your blood vessels, your capillaries. And it's measured by the ability to deliver oxygen to the muscles and the capacity of muscles to use the oxygen for physical activity. And we can actually, when we measure that ability to deliver oxygen and how well your muscles use it during physical activity or aerobic activity, it's called the measurement of your VO2 max. And it's a very uncomfortable, we call it a stress exercise test. It measures your ability to consume oxygen and how it's used efficiently within your muscles when you're performing exercise. Now, the higher your VO2 max is, the more aerobically fit you are, okay? It's very uncomfortable. You actually are on a treadmill, and depending on your health status, you're either running or walking on the treadmill, and you're also, your nose is plugged, and you're also breathing through a tube. It's very clinical and it can be very costly as well. Okay, there are formulas that you can perform to estimate your VO2 max, but to get the most accurate measurement of your VO2 max, you should perform it clinically through like a hospital. Sometimes Kaiser might have these. My university that I attended had them in the exercise physiology labs, the kinesiology labs. They also offered it to the public if you wanted to get it done, but we did it through our labs that were required for my studies. But it's a very uncomfortable test, this maximal VO2 max test. Now, again, I want you to know that the length of time muscles can work against a weight or force depends largely on this cardiorespiratory fitness, which involves your respiratory system and your cardiovascular system, okay? And some activities that are examples of this are jogging, basketball, swimming, soccer, dancing for a prolonged period of time, and other low to moderate intensity activities. So there's usually activities that are more low to moderate in intensity and you can sustain for a long period of time. Whereas muscular strength has to do more with activities that are performed in a shorter period of time and quick spurts, okay? They don't last very long. So cardiorespiratory fitness levels build up with time as individuals increase the level of aerobic exercise. So when you're on a program that challenges your muscular endurance or your cardiorespiratory fitness, you will become more efficient on how you utilize oxygen, how you consume oxygen, and how your muscles use it. And also you can build on your fitness levels, meaning things that you used to do before are now easier. So you have to increase the duration of time that you exercise or how hard you exercise, okay? And maybe even the actual movements that you're performing. Now, aerobic exercise increases cardiovascular fitness in 3 ways. It strengthens and expands the capacity of the lungs to deliver oxygen. It increases the ability of the circulatory system to deliver blood and oxygen to muscles and other tissues throughout the body, not just during exercise, but during rest. And it strengthens the ability of the heart to move and increase volume of blood through the body. I also want you to know in your cells, you have this organelle called the mitochondria. Now the mitochondria is, it's very red in color, and that's because it has a high blood supply, rich blood supply. Did you know that where we make aerobic energy is usually in the mitochondria? It's a powerhouse for us to use during exercise. It's the site of energy production when we are utilizing oxygen for activities. So people that are more aerobically fit or their fitness has increased, they also make more mitochondria, so they can increase the amount of mitochondria in their cells or enlarge the mitochondria that they have. And by doing that, it also increases and helps with increasing cardiorespiratory fitness or muscular endurance as well. So a little bit more about muscle endurance and cardiorespiratory fitness. Again, it's physical activity in which the body's large muscles move in a rhythmic manner for a sustained period of time. It involves metabolic pathways that require oxygen, like I mentioned before, and the site of oxygen energy production when you require oxygen is the mitochondria. And it improves the function of the cardiorespiratory and respiratory systems. It includes, example, like I mentioned before, walking, jogging, running, swimming, skiing, vacuuming, house cleaning, lawn mowing, raking, cycling, and aerobic dance. And we have some movements here that are a little bit more like household based, where we have some more that you can do more outdoors or within the gym if they have programs. An example of aerobic exercise is jogging to low moderate intensity for about an hour, half an hour, okay, for a little more sustained time. So there are ways that we can measure your cardiorespiratory fitness. So it can be assessed by measuring, like I mentioned before, your maximal oxygen consumption, referred to as VO2 max, under supervision in the laboratory. I did mention that before. Now, again, I mentioned that it's uncomfortable. And just to go over it again, it's measured when a person's nose is plugged, so she or he must breathe through a tube that delivers air. It's very uncomfortable. The tube is attached to an apparatus that measures the total amount of air breathed in and out, and it calculates the difference between the amounts of oxygen you inhaled and exhaled during this exercise stress test. And then every few minutes, the resistance of the cycle is increased, making the exercise more intense. And sometimes these tests will keep increasing in intensity until you give up, until exhaustion. The amount of oxygen a person uses at the point when exercise intensity can go no higher is considered your maximal oxygen consumption. So I've had this done. It's very uncomfortable, and they did, because I'm a healthy individual, I did not have a modified exercise stress that some people do, like elderly people with conditions. They kept increasing the intensity of this aerobic activity, which I was running on the treadmill, until I exhausted and gave up. People can perform again this activity at 100%, only for a few minutes. So when they determine your VO2 max, it's a number. The higher it is, the more aerobically fit you are. Excuse me. And they can keep measuring it over time to see if your fitness has increased. You can perform that only for a few minutes, okay, until you exhaust. Therefore, aerobic fitness goals are usually set below that level. Okay, you will meet with this expert as well. Using these laboratories are only performed by certain people, like kinesiologists. It is recommended that beginners start a cardiorespiratory fitness program with the goal of exercising at 40 to 60% of your VO2 max. So whatever that number is that's determined at the clinical setting, they will make calculations to make sure that you perform exercises starting program 40 to 60% of that number. So here is a little image of a male here performing a exercise stress test called a VO2 max test. I want you to know the most accurate way to determine physical fitness based on heart rate is to have it performed once again measured directly in a laboratory clinical setting, okay, because their machines require calibration professionally, and they're kept up more to par. Now, there's a lot of fitness devices there that claim to be accurate in determining your heart rate, but just know that if they don't go through certain calibration processes where they get old over time, they can become quite inaccurate. Now, heart rate is used as an indicator of cardiorespiratory fitness and exercise intensity. The lower the heart rate, the more efficient your body is at delivering oxygen to cells and utilizing glucose and fat for energy formation. So especially when you hit a certain intensity, when they measure your heart rate, they can also determine how you're responding to the intensity of your aerobic activity. Now, resting heart rate reflects the number of times per minute your heart must beat to maintain bodily functions while you are at complete rest. It can be used to help track progress in becoming physically fit. A lot of physically fit people have a lower resting heart rate compared to individuals that are not physically fit. But please note that some factors to consider are like elite athletes. Some elite athletes, like endurance athletes, like triathletes and marathon runners that are very elite at that higher level, they will have sometimes they can have an extremely low resting heart rate. And often it should still be tracked, because if it's too low, it can also mean that you're not getting enough oxygen to your tissues during rest. But if it's below, I usually say if it's below 40 beats per minute, you should consider getting consultation, okay? But a lower resting heart rate also can be good, because it's showing you that your heart has to work less during rest to deliver oxygen to your tissues. So here's an image of a female assessing her heart rate. at a certain point during physical fitness. Sometimes when you perform physical fitness activities, you sometimes can perform activities, then measure it and go on and continue your exercise to see how your cardiovascular system is responding to the physical activity. And here is the very old school way. We really don't assess it that way. Back in the old days, we would use our pulse and quietly record how many beats per minute we are counting, and then refer to a chart. But nowadays, we have fitness devices. Now, I spoke about how VO2 max, that number is determined by total exhaustion when you cease physical activity. Now, maximal heart rate, or MHR, is the same way. So it's the rate at which the highest level of oxygen delivery to working muscles can occur. And once we determine what your maximal heart rate is, we can also develop physical activities around that and divide those activities into intensities. For example, whatever your maximal heart rate is considered, and like I mentioned before, the most accurate way is to get it done in the laboratory or clinical setting. So whatever that number is, for example, if it's like 220 beats per minute, then moderate intensity activities will be considered 50 to 69% of that 220. And intense activities would be considered 70 to 90% of that 220. Now, everyone has a different maximal heart rate. That's why if you can have access to a laboratory, sometimes Kaiser has facilities where you can get it done, and also universities that have kinesiology programs have laboratories that you can get that done. But everyone has a different maximal heart rate because there's different fitness levels. Now, identifying estimated maximum heart rate and using heart rate targets for physical activity can help individuals monitor their progress. So, for example, if you used to jog at 7 miles an hour, which is it's quite fast, and you would measure your heart rate, and it was like maybe like 150 beats per minute, and then maybe you became more physically fit, and jogging at that same speed at 7 miles per hour, you found that your heart rate's now more like 145 beats per minute, then you've become more physically fit. So that activity that you were performing at that intensity level, your heart rate is showing improvement in cardiovascular fitness because it's having to work less harder. Target heart rate, so it's just showing you here in general, based on age, what is the common maximal heart rate, and what you should perform certain activities at certain intensity. So a 20-year-old, for example, most of them can have a maximal heart rate of 200. So when they're performing moderate activities, they should perform at about 100 beats per minute. And 85% of the maximal heart rate would be 170 beats per minute. Okay, another example, if you're 30-year-olds, common maximal heart rates for 30-year-olds are 190 beats per minute. So 50% of 190 would be 95 beats per minute. 85% of 190 is 162 beats per minute. So you would a lot of people also use fitness devices to keep track of their beats per minute, and when they know they have a ballpark of what that percentage is. So wearable devices and smartphone apps. So I did mention once again that there's lots of technology that you can use to monitor your heart rate. Some of the wearable devices and their apps are able to calculate steps and speed with reasonable accuracy, 88 to 98% of the time. But again, sometimes as they get older, they have less accuracy than that. Smartphone sensors and apps are very close to being accurate at least 93% of the time. And there can also be errors in those sensors and smartphones, that the person may be moving too much, not putting certain body parts like the fingers on correctly. And again, you must update those apps that you're using as well, because they can become less accurate over time. Activity monitors are available that provide automated feedback and interactive behavioral change tools via smartphone or computer. You can also use certain apps to download information onto your computer. So let's speak about flexibility. So flexibility is another component of a physical activity program or exercise program. It refers to the range of motion, muscles, and connective tissues around your joints, or how tight or loose your body movements are. and it affects your ability to stretch, react, bend, and maintain balance in agility. It is also important for day-to-day activities such as walking, reaching, moving smoothly and quickly out of danger and balance. Okay. Um, and it's maintained and increased by many types of physical activity. So especially stretching exercises are the main type here. So things like yoga, which involves stretching exercises. And you can also perform, stretches can be performed in rhythmic movements where you move from one muscle group to another, or you can also hold it a little bit more static. So here's an example of someone performing a flexibility exercise. It's static stretching. So she's leaning forward and touching her leg. So stretching increases flexibility and reduces muscle stiffness when it is done before beginning to exercise. That's what your book says. I will let you know that according to kinesiology research, sometimes it's better to stretch afterwards because your tendons and ligaments are elongated and there's less injury to occur. And as far as warming up, it should be more in relationship to the movements that you perform. For example, if you're going to be doing squats for the day, a good warm up would be performing body weight squats with no weights just to warm up the ligaments and tendons and the muscle groups, and maybe some back bends because you use your torso a lot when you squat, and also your shoulders, so you use the whole body. And then after you've done like some of the rhythmic movements and compound movements, body weight wise, then you can start performing your stretch. And so if you are doing stretching before your program versus after, make sure you perform some more rhythmic movements first so that you elongate the tendons and ligaments a little bit. Okay. Most of us have experienced soreness to some point or another if we've been on an exercise program because we use muscles or muscle groups that we've never used before in manners that we've never used before. You can experience muscle soreness right after you work out, soon after the day as well. Sometimes you don't. Sometimes it can take 2 days in order for you to experience soreness, and that's called delayed onset muscle soreness, referred to as DOMS, the acronym. And it's muscle pain, soreness, and stiffness that occurs a day or two after exercise of muscles that are not normally used to high levels of activity. And it can last for a while. So once you experience the initial stage of delayed onset muscle, it can last for weeks, a week and a half, depending on how you're recovering and how hard you worked out, okay, and what was your fitness level prior to that session. Now, overused muscles develop microscopic tearing in muscle fibers that cause stiffness and soreness for a day or two. I actually got to experience muscle fibers in marathoners when I did my undergraduate degree. And we can see that the muscle fibers, the calf muscles particularly, were torn. So it would take some recovery for those to repair themselves. And then within a few days, your muscles recover and actually end up in a better state to be strengthened. And diet has a lot to do with that as well, okay? If for those of you that are sports enthusiasts in here. Now, muscles rebuild and become ready for the next bout of use, okay? DOMS contiguous is most likely to occur when you use muscles you don't generally use for vigorous physical activity, when you engage in physical activity, when you are out of shape, starting hard too fast, dramatically increase exercise intensity or duration of physical activity, running downstairs or downhill, or engage in other downward motions as well. Most of you have heard the term you're burning fat, you're burning carbs, etc. when you're exercising. Now, different types of activities utilize different types of macronutrients for energy. So muscles use fat, glucose, and amino acids or proteins for energy. Now, it's dependent on the intensity that you're performing the exercise. So intensity is a factor, and also duration. Okay, so how long? So the proportion and the amount of each that is used depends on the intensity of the activity as well as the duration. When we're inactive, so when you're at rest, fat supplies between 85 to 90% of the total amount of energy needed by muscles. So if you're at rest right now and you're listening to this, most of your cells at rest utilize fat as energy. And there's some exceptions like the brain cells and the red blood cells that don't have mitochondria that utilize glucose instead. The rest is provided by glucose and amino acids. Fat is also the primary a source of fuel for activities of low to moderate intensity, such as jogging and swimming. So if you perform activities that are more lower to moderate in intensity and longer in duration as well, you're going to be utilizing more fat for that activity. But you can also be utilizing carbohydrates for some cells. We're talking about primary source. So here are some examples from your book. So swimming, walking, house cleaning, cycling, and gardening. So activities that are more prolonged, more low to moderate, utilize more fat. They may utilize glucose and amino acids, but mostly primarily fat. Now, activities that are the opposite, they're more high intensity and shorter in duration, utilize more glucose. So high intensity, short duration activities, like I just mentioned before, so more powerful exercise movements that are higher in intensity, shorter in duration, like jumping, throwing a fastball, or sprinting down the block to catch a bus or to run from someone, are fueled primarily by glucose or carbohydrates. Now, you can also get glucose from proteins, but it mainly comes from carbs. But you utilize proteins when you don't have enough carbs in your diet or in your body. Our supply of glucose for intense activities comes from glycogen, so that's stored form of carbohydrate. Glycogen is stored in muscles in the liver, as we learned, and can be rapidly converted to glucose when needed by working muscles. So some examples of these activities too, I listed some here. So if you wrestle for a couple minutes, usually 2 minutes or less, or you'll be using a lot of glucose for that. If you perform HIIT activities, which is like you work hard for a minute and then rest for a minute, and then the durations can vary depending on the HIIT program, then you're also utilizing mainly carbohydrates or glucose, okay? Now, some activities can utilize many of the macronutrients. For example, some activities like basketball have movements that are very quick and explosive, which you utilize a lot of glucose, but also it may go for a long period of time. So you also be utilizing fats as well. Now, high intensity, short duration activities represent anaerobic exercise. Anaerobic is the opposite of aerobic exercise. Anaerobic exercise, you don't utilize oxygen for these activities, whereas aerobic exercise you do. And that's because the conversion of glucose to energy does not require oxygen. People can undertake very intense activity only as long as their stores of glycogen last. So if you've ever heard of hitting the wall in the marathon, for example, it's because people have depleted their glycogen stores in their muscles and liver. Now, activities such as basketball, hockey, tennis, football, and soccer, which involve walking, running, and high-intensity quick moves, use both fat and glucose for energy, like I mentioned before. So we're looking at the duration and the intensity of these movements. A little reminder about water. Believe it or not, some studies show that being well hydrated increases physical performance 20 to 30%. Okay, so physical activity increases the body's need for water. It's very easy to lose water when you exercise as well, because you lose water through your sweat, and also environments can affect it in the type of clothing. If the climate is hot and humid, this need increases even more because you lose water more frequently. People should drink in response to thirst as well. You are consuming the right amount of water if your urine is pale yellow and normal in volume. So I usually also say like a light yellow lemonade color. If it's too clear like water, it's showing that you're probably diluting your electrolytes that are needed for like muscle contraction and relaxation, like sodium and calcium. If it's too yellow, it's showing that you're not getting enough water. There's a high concentration of electrolytes. However, if it's like a light lemonade color, it's showing the right proportion. I also want to let you know that if you're an endurance athlete in here, you're going to run like 20 miles, or you're a cyclist, it's going to do like a 100 mile event. It's okay to be super hydrated, meaning that your urine should be a little bit more on the clear side, because you're going to utilize a lot more water for that activity, okay? So I wanted to let you know there are some organizations out there responsible for putting out physical activity and exercise guidelines for Americans. So the first one is Physical Activity Guidelines for Americans. That's what it's titled. It's developed by the Department of Health and Human Services to improve the physical fitness and fitness levels of Americans. So here is a major guideline from the Physical Activity Guidelines for Americans by the Department of Health and Human Services. So they recommend at least 150 minutes per week of moderate intensity aerobic activity. Moderate intensity activities are those that increase your heart and breathing rates. And here are the following: brisk walking, jogging, scrubbing floors, operating a wheelchair, and manually or playing a sport from a wheelchair, running around with children, fast dancing, tennis, and playing basketball. Now, this is a great recommendation, but it shouldn't be the only guideline that makes up your exercise program. I also want you to know that exercise, again, a branch of physical activity, is a very it's a science. It's highly structured, and you should also incorporate, in addition to this, you should also consider and sit down with someone that's like a personal trainer. Again, usually personal trainers that have a kinesiology degree and keep up with their certification sometimes can be the best resources. And if someone that has, like, for instance, if you have access to professors that also run kinesiology programs at their schools, they're also great resources. But if you get a chance to sit down with a professional, they can also cover how hard you should be working out, so intensity, how much work you should be performing, your volume, how frequently you should be performing certain movements and regimens, and also how long, the duration. Okay, so they will also cover those factors in addition to these guidelines.